Dear colleagues, dear journalists, I welcome you to our press conference on COVID-19 today, Monday, 7 September. I am Fadela Shaib, Communication Officer at WHO headquarters in Geneva, moderating this press event. We have with us, as always, Dr. Tedros, the WHO Director General, along with Dr. Mike Ryan, WHO Executive Director of the Emergencies Program, and Dr. Maria von Kerkhove, our technical lead for COVID-19. They are in the room. In the room also we have Dr. Maria Angela Simao. She is our Assistant Director General, Access to Medicines and Health Products, and Dr. Bruce Aylward, Senior Advisor to the Director General, who leads on the ACT Accelerator. We will also be joined by Dr. Sumya Swaminathan, our Chief Scientist. As usual, we are translating this press conference in the 6 official UN languages, plus Portuguese and Hindi. We will be posting the Director General remarks and an audio file of this press conference on the web as soon as possible. The full transcript of this press conference will be available later on the web. But now, without further delay, I would hand over to Dr. Tedros for his opening remark. Dr. Tedros, you have the floor. Thank you.
Shukran Fadila. Good morning, good afternoon, and good evening. COVID-19 is teaching all of us many lessons. One of them is that health is not a luxury item for those who can afford it. It's a necessity and a human right. Public health is the foundation of social, economic, and political stability. That means investing in population-based services for preventing, detecting, and responding to disease. This will not be the last pandemic. History teaches us that outbreaks and pandemics are a fact of life. But when the next pandemic comes, the world must be ready, more ready than it was this time. In recent years, many countries have made enormous advances in medicine, but too many have neglected their basic public health systems, which are the foundation for responding to infectious disease outbreaks. Part of every country's commitment to build back better must therefore be to invest in public health as an investment in a healthier and safer future. In fact, there are many examples of countries that have done exactly that. Thailand is reaping the benefits of 40 years of health system strengthening, a robust and well-resourced medical and public health system, allied with strong leadership informed by the best available scientific advice, a trained and committed community workforce with 1 million village health volunteers, and consistent and accurate communication have built trust and increased public confidence and compliance. As you know, Italy was one of the first countries to experience a large outbreak outside China, and in many ways was a pioneer for other countries. Italy took hard decisions based on the evidence and persisted with them, which reduced transmission and saved many lives. National unity and solidarity, combined with the dedication and sacrifice of health workers and the engagement of the Italian people, brought the outbreak under control. Mongolia acted very early, activating its state emergency committee in January. As a result, despite neighboring China, Mongolia's first case was not reported until March, and it still has no reported deaths. Mauritius has high population density, with high rates of non-communicable diseases, and many international travelers, which meant it was at high risk. But quick, comprehensive action initiated in January by Mauritius and previous experiences with contact tracing paid off. Although the Americas has been the most affected region, Uruguay has reported the lowest number of cases and deaths in Latin America, both in total and on a per capita basis.